Hi everybody, Dr. Dranjanabhana here and welcome back to my channel. And today we have our beautiful Beverly here. Bev's always happy, always smiling, and she is a bit concerned about the creation of these lines. They're called nasolabial folds. So we're going to soften up the nasolabial fold, we'll chat a little bit about it. And another concern for Bev is also the under eye area. So we've disinfected Bev's face. I'm probably going to touch a little bit, so I might disinfect definitely again. Just a little thing on the nasolabial fold. So when I started about 12, 13 years ago, it was a very common thing to fold. And we used to use needles and just like poke our way in there, fan, and do all these dangerous things, but we know now that this is the most dangerous area to do something like that in. And mostly in terms of restoring the area, it's nice to go deep on bone in something called the piriform fossa and pop the nasolabial out. Or I'm going to use this. I'm going to do this today. It's called like using a cannula and going into the subcutaneous tissue slowly and filling the area like so, bringing up the volume. But when you smile, like when you're at rest, actually, Bev, you can see these lines there, and that also bugs patients. So superficially, we're going to do something called skin boosting using a skin booster and using a technique I actually saw ages ago, and it's also like now very popular on Instagram, but it's a proven technique by Dr. Tom van Eyck. It's called the Fern technique. So basically building a scaffold and strengthening the skin, because when we age, it's from bone down to skin. So losing bone shifts in fat and loss of elasticity. So now I'm going to do the under eye area. Like I said, we're going to under treat the area, and obviously Bev's a little nervous because it's close to the eye, but it's actually a relatively safe area to treat, especially with cannula. Danger zones are the area we just treated, the nose and glabella, especially with filler. Although there are no non-danger zones in the face, some areas are just safer than others. So we just have to know exactly where we are and at what level the blood vessels are in. And I just recently acquired an ultrasound device, so that would be really nice to map vessels, as well as just knowing as well your anatomy and depth of vessels. So sorry, Bev. Okay, let's relax. I'm going to give you a little poke. So Bev, you'll just hear a couple of clicks. Just relax. Here we go. I'm going to put very little here. That's it. So it's important not to overfill the tear trough, and also to be at the correct depth. So either on the periosteum or under the muscle, not superficially, because that tear trough filler can stick around for many years. And as you can see, I put very, very, very little for Beverly. I mean, she is here. You can always come back for more sessions, which you probably will have to. And just to remember to underfill, because over 2 weeks, this filler is very hydrophilic. It likes water. It'll absorb quite a bit of water, and also it'll look more radiant, brighter, softer after 2 weeks. And we can always add filler. So I'd probably, give it a space of at least 3 months before I put in any more filler in the area. And we're just going to do the other side. Okay guys, so thanks for joining me today. We've done Bev's nasolabial fold filler, as well as some Fern technique in the nasolabial fold, and a bit of under eye filler for Bev. And if you have any questions about any of the procedures we've done, why we've done them, please drop them down in the comments down below, and like, share and subscribe. Thank you. Bye.